So I'm a consultant interventional radiologist based at Aintree University Hospital, and I also work at the Sefton Suite. I perform image-guided procedures, including prostate artery embolization, which is a very new and exciting procedure. Prostate artery embolization is a very new technique that's been introduced to treat men with benign prostatic hypertrophy. This condition is quite common. It affects men over the age of 50, and men who come to see me usually complain of symptoms of difficulty with urination.
Having a prostate problem is going on a journey. There is no quick fix. From the time you realise you've got a problem, which is usually a water problem, you have trouble going to the toilet. When you do go, it's very slow. It takes longer and longer. Eventually, it more or less stops, and that's when, as a man, you realise you've got to do something.
The first thing I seemed to notice was with Sid's problem was when we went on holiday. We actually went over to Australia to visit family, and whilst we were there, we stayed with our daughter. Now, unfortunately, Sid's problem became a bit more problematic in the night times. He used to get up 3 and 4 times, which unfortunately disturbed most of the household as well. And it became so bad, even while we were there, that he actually went to the GP.
The medication you have to be on for the prostate problem, it's really depressing stuff really. You have to be on it, but the side effects, low blood pressure, hair loss, erectile dysfunction, low sperm, it all takes a toll on your self-esteem. It takes its toll on your wife because she knows you've got low self-esteem, she tries to encourage you. But at the end of the day, you're a man, but basically, with all the medication, you're not a real man.
Prostate artery embolization was first introduced in 2009 in Brazil and Portugal. We started doing this procedure at Aintree University Hospital and the Sefton Suite since 2012. This procedure has shown a success rate of greater than 70%, and it has significantly improved the quality of life of many patients that I've treated.
We have the procedure, basically local anaesthetic into your groin, a needle into the artery that feeds the prostate. They partially block the artery up. It's a bit like a stent in reverse. A stent is to open your artery, this is to slightly block it, which cuts the blood supply down to the artery, to the prostate, thus making it shrink, solving all the problems.
The procedure is minimally invasive. It involves staying in hospital for a day, and patients sometimes can even be discharged on the same day. The procedure involves passing a small fine plastic tube through the groin into the blood vessel that supplies the prostate gland. Once the plastic tube, which we call a catheter, is in the correct position, small tiny particles called embolization particles are injected through this plastic tube to stop the flow of blood into the prostate gland. What this does is it allows the prostate gland to then shrink and return it to its original size. Therefore, the symptoms will improve over time.
Whereas this embolization to me has freed him from tablets. It's given him a new life, and me too. And I just can't thank everyone enough what's been done for me.
What we found was that patients have shown significant improvement in their symptoms after the procedure. Unlike traditional methods of treating this condition, such as TURP, which is a surgical procedure and fairly invasive, patients who have prostate artery embolization do not have the same side effects or complications from surgical procedure.
But having come through the other end now, we are very, very happy. I couldn't be happy with the Dr. Kumar for all he's done for my husband. In fact, I owe him a great debt of gratitude. And we are so happy now, and hopefully we go from strength to strength.
We are immensely proud that Aintree University Hospital and the Sefton Suite are able to offer prostate artery embolization to men with benign prostatic hypertrophy who meet the criteria. This procedure has achieved incredible success and our results so far have been excellent.
I must say that since I had the prostate done, at least a week after I had the procedure, I have been 100% better. I have no symptoms, no side effects. Life is wonderful.
My message to anyone who feel that they may benefit from this treatment would be to get in touch with their GP so that the appropriate referral can be made to the Sefton Suite, and we will be delighted to discuss the options with them.